Dr. Sanketh Reddy, Senior Implantologist, Apollo White Dental, Chennai. I've been practicing implantology since 20 years. Dental implants can be done right after tooth removal or even after 6 months, but not more than a year. It depends upon the amount of infection, the amount of bone, and the systemic conditions. Most commonly, we come across high blood pressure and diabetes. If both are under well control, implants can certainly be done. If you have got any pre-medication like blood thinners or other medications, you need to disclose to your dentist before doing any surgery. So accordingly, they will take an action or they will prescribe any other medication to substitute that and carry on with dental implants. If you are on blood thinners, you need to disclose it to your dentist, so therefore he can have an alternative plan before going on to dental implants. Types of crown materials majorly depend upon what is the exact requirement, like if it is an aesthetic. Type of crown materials depends upon the requirement of aesthetics or function. If it is an aesthetic, we need more amount of naturally looking tooth. If it is function, we need more harder substance. But recently we have zirconia, which is a combination of both hard and aesthetics. So therefore they can be used either in the front teeth or in the back teeth. Implant costs vary from patient to patient, to mostly say even from upper jaw to lower jaw. It majorly depends upon the type of bone, the type of infection, the type of requirement. The success rate of implant is almost 98% worldwide, and we at Apollo White Dental provide the same amount of success rate with proper sterilization and proper protocol procedures.